Many of you who are coming in have had a previous surgery before, and whether it's a hip or a knee replacement, it's important to realize that if you're coming in for a second opinion, or maybe it's just routine follow-up, but you've moved, it's another surgeon, whatever the case might be, if you have an existing joint and you're coming in to see another orthopedic surgeon, I think there are a couple of things that are very helpful to have on the front end. And it starts with any documentation that you have. Could include operative reports, any labs that have been done recently, any additional testing or other opinions that you have. Those notes are very important and very helpful, and ultimately can lead to a more constructive conversation. The other thing is imaging. So if you have previous x-rays, that can be very helpful. If you've got advanced imaging, things like CT scans or MRIs, bring those in, because the more we have when we can sit down and talk to you, the more productive it can be. Only caveat to this, when you're bringing images, don't just come with a report. We care about what the images look like. We want to look at them with you. So if at all possible, always bring a copy of the disc, and that way we can upload it and we can look at it together. And if you do that, I think not only is it going to be more productive, it'll ultimately save you time, and in many cases make it easier and faster to diagnose what's going on and start treatment.